Hi, everyone. Thank you so much for joining us for CMD's Affected Individual Mental Health Part 1 webinar. If you were with us a couple Saturdays ago for our Caregiver Mental Health mini-series, welcome back. Thank you so much for spending a little bit of your Saturday with us again. My name is Avery Roberts, and I work in Outreach and Engagement for CMD. I'm also here alongside Kelly Berger, the Outreach and Engagement Coordinator, and the rest of our CMD outreach team. We're very excited to continuing this journey with you as we dive into the new year. Can't believe it's already February and getting refreshed with our mental health. All right, so for today's discussion, we're going to learn how to work through self-reflection and acceptance by making the most of our condition. So we are also going to learn no stress strategies for managing care, along with helpful coping strategies and general mindfulness and wellness practices. So let's meet our speakers. We have BRIANA Mills, who is an associate marriage and family therapist. And we also have Angela MACCARRONE, who is a teaching staff classroom assistant at the Seattle Children's Alyssa Burnett Adult Life Center. She is a clinical psychology PhD student at Seattle Pacific University. And then both our speakers today are CMD community members because they both have Sal-Anon CMD. So welcome, ladies. All right, so enough of me talking now. And now, BRIANA, would you like to start us off with living with a disability and having therapy as an outlet?
Yeah, sure. Hi, everyone. Let me share my screen with all of you. So again, thank you all for coming. My name is BRIANA Mills. I'm an associate marriage and family therapist. And today I'm going to be talking about the benefits of therapy. So just before I talk about anything else, I want you all to know that whatever you're going through right now, currently, whatever you're struggling with, whatever you're feeling, you are definitely not alone. I know a lot of people, especially with COVID right now, are feeling very isolated, very like their feelings are just by themselves. And I want you to know that you definitely share a lot of the same feelings as a lot of other people. So this is me. I was born in 1992, and I was also born 3 months early. And like Avery was saying, I have SEPN1 congenital muscular dystrophy. So fast forwarding to 1997, this is when I first started kindergarten. I was the only kid from K through 12, meaning all through my entire public school career, that had a visible physical disability. That made it very challenging through school. And fast forwarding through 2010 is when I graduated high school. So that entire time, I was the only one through school that had a visible physical disability. During that time, I went through 4 major surgeries. That was very complicated through school. I had to take a lot of time off, as well as recover from a bunch of those surgeries. So that caused me to use a walker and transition to a wheelchair as I got older, just due to all of the surgery recovery time. And I also, I had a lot of bullying a lot growing up, just because, I was the only one that kids saw that looked different. So bullying was a big issue growing up. Starting at 2014, that's when I decided to move out of my mom's house and start college. I lived in the dorms. Starting to figure out how to take care of myself using caregivers was very challenging, trying to figure out how to be independent, how to get the care that I needed. it was very complicated. I had a lot of difficulties with that. I was also in and out of the hospital a lot due to getting pneumonia. Unfortunately, whenever I get like a regular common cold, it can turn into pneumonia very quickly just because I'm not able to cough anything up very regularly because of my lungs and my muscle capacity. So it would turn into pneumonia very frequently. I also didn't start dating until the age of 22. Unfortunately, that's a pretty common thing for people with disabilities to start dating a little bit later in life. So the dating aspect was difficult as well, just because, you know, throughout life, a lot of disabled people experience a lot of ableism in society. A lot of people don't really know how to navigate dating as a disabled person. So yeah, I had those challenges. And I'm also a sexual abuse survivor. So I did date someone who was physically and sexually abusive. But there's no shame with that. Unfortunately, there's also a lot of commonalities with disability and sexual and physical abuse. So I'm one of those people. Going to now, I have a master's in science, marriage and family therapy. I specialize in people with disabilities as well as minorities. I'm also trained in EMDR, which stands for eye movement desensitization and reprocessing, which is used for trauma patients. It also helps to decrease PTSD symptoms. I'm also a board certified telemental health therapist, and I'm also a disability advocate. So managing my own mental health, I started going to therapy when I was 5 years old. That was pretty much due to my parents' divorce when I was 5. My mom thought it would be a good idea for me to start talking to a therapist about it. Although I did get a lot out of it, it was challenging for me to be in therapy just due to the fact that my therapist didn't really understand my situation as a disabled woman. It was very hard for me to be able to open up just due to the fact that my therapist didn't really understand my situation and understand my challenges. Although one thing that did help me to manage my mental health a lot was singing. I still love singing. I do it all the time. I was all through school. I was in choir, and it really did help me to join a community, make friends. I was also in private singing lessons, so it was one thing that really gave me joy and felt like I was good at something. And it's also good for me physically. Singing's good for like your breathing and your diaphragm and your lungs and things like that. So it was like a physical workout as well. And also just meditating. I meditate frequently whenever I'm feeling very anxious or stressed. There's also a grounding technique called tapping, which I highly encourage you all to Google and research. So doing those kinds of things really does help me manage my mental health. So how I got involved in mental health. So again, like I was saying earlier, I really did find a need for disabled therapists. So I did see that therapist that I was talking about on and off for about 10 years. And I stopped seeing him for a while, and I decided to go back to therapy after I started grad school. And I saw quite a few therapists because I wasn't really finding one that really fit me. A lot of the reason was because my mental health issues had a lot to do with my disability. specifically. And a lot of therapists just, they would ask me questions like, what do you mean by that? Or, oh, I can't imagine how that must feel. And I felt like I was doing more education with my therapists than actually being able to talk about how I'm feeling about things. So I realized off the bat that, like, wow, there really is a need for people like me in the mental health field. I also have firsthand experience helping people with their mental health. When I was about 12 years old, one of my best friends called me after they attempted suicide. And, when you're 12, that's a really scary thing. And I realized that I was able to help her and be there for her. And that kind of helped me figure out, like, oh, wow, I'm actually kind of good at this. And I really do like it. And the other thing was, growing up, I did also have to figure out, there's careers that I'm just physically not capable of doing because of my disability. So I had to figure out what's something that I really enjoy that I can also do physically. So I always tell people, like, well, I can't use my body in a lot of situations, but I can use my mind. And therapy was just something that fit, where I was like, okay, I can help people emotionally, even though I can't do things physically. So how my muscular dystrophy shaped me as a therapist. So I have a very unique perspective on things. Not to say that I'm, one of a kind or super special, but I do have a unique perspective on how I see the world and how I see others. And that kind of helps me have really deep empathy with people. Whenever clients come to me and they tell me their struggles, I automatically kind of understand exactly how they're feeling, because I know how it feels to have really hard, terrible obstacles in your way. And how my muscular dystrophy benefits my disabled clients. We both get a sense of gratification from it, knowing that I'm actually helping other disabled people, and that we're able to kind of get each other. There's that relatability that we have, like this guy that's like, oh yeah, there's stairs, I can't go that way, right? Like, a lot of people who don't have disabilities don't really understand what that feels like. So we're able to relate to one another. And we have that kind of understanding of, like, oh, wow, like when I talk about my caregivers, or when I talk about, not being able to use the bathroom on my own, like, I get it, like I understand it right away. And that's how we're able to build rapport really quickly. They come to me knowing that when they talk about their disability, that I'm going to be able to understand it. And we both kind of get a sense of relief, like, oh, finally, I don't have to explain myself. I don't have to, like, tell her all of these things that, most people don't understand, because she already gets it. And I want to let you all know that it's okay to reach out for help. The reason I say that is because there is still a lot of negative stigmas that involve therapy. Unfortunately, therapy's only been around really for the past, like, 150 years or so. And, like, the actual diagnoses and things like that really haven't been around for more than, like, 60 years. So it's still a very new field, and there's still a lot of negative stigmas around it. A lot of people feel, embarrassed or ashamed when they feel like they need therapy. But like I said, you are definitely not alone. A lot of people share those same fears. Everyone needs someone to lean on. I know that we're a very individualistic society, But we honestly do rely on other people for a lot of other things. I mean, if you go to a car, like if your car breaks down, you go to a mechanic and they help you fix your car, right? Like we rely on other people for help all the time. And I try to remind my clients of that. It's okay to reach out for help. And you can express yourself without being judged. Like therapists are there to make sure that you're feeling heard and feeling seen, and that they're not going to judge you for what you say. And I also try to remind everyone that therapy is not a weakness. It doesn't mean that there's something totally, completely wrong with you, that mental health is exactly like physical health. So if you break a bone, right, you go to a doctor and you get that fixed. If you feel severely depressed or severely anxious, you go to a therapist and you get help. It's pretty much the exact same thing. There's really not a huge difference. Therapy is self-compassion. It means that you're actually trying to be kind to yourself. You're trying to be understanding with your emotions. It's empowerment, meaning that you're giving yourself more control over what you need. And it's also validation. It's kind of just admitting to yourself, like, hey, this is how I'm feeling, and that's okay. Therapy also helps you guide your path. A lot of clients come to me and they don't really know like who they are or what they want out of life. And therapy can definitely help you parse through that. And it's really all about what you want. I mean, how many spaces do we have in life where it's really all about you? And it helps clarify any confusions that you have. A lot of clients come to me and ask, like, hey, should I do this or should I do that? And I don't necessarily give answers, but I really do try and help guide them on how they truly feel. And, again, learning that self-compassion, learning to be understanding and kind with yourself. So this is online therapy and what it can do for you. One of the huge things about online therapy is that it's really convenient, right? Like you don't have to leave the house. You can just stay home. You don't even have to really get dressed, It's really nice. You don't have to figure out transportation, which a lot of my disabled clients do have challenges with. So telehealth therapy is very beneficial for them. It's also very accessible. All you really need is a computer or a phone, and it's right there. It's also very safe, meaning that, a lot of people, the reason they don't want to go to therapy is they don't want to go to an actual office because, there's other people there in the waiting room, things like that. They kind of feel embarrassed to be seen there. But with telehealth therapy, I mean, you're at home and no one else really knows about it. So, and it's also really effective, meaning that there's really no huge difference between online therapy and in person. And it's helpful. It helps to give you tools on how to manage your emotions, how to manage your mental health and your coping skills, things like that. So this is an exercise. We're not going to do it right now, but I do want you all to kind of think about this question while I'm still going through, and then we can talk about it later. This is an inner child exercise. What I mean by that is inside all of us is our inner child. It's who we were as a kid. And that's still kind of there, even as we get older. Our kid, who we were when we were young, it's still inside of us. And my question to you is, if you could say one thing to your inner child, what would it be? I do a lot of inner child work with my clients. And, we don't have to talk about anything really deep or traumatic or anything like that. But, kind of looking back and being like, my inner child could really use comfort, or my inner child could really use validation. If I were a kid, what would I want to hear? What would I wish someone would have told me? So I would like you to just think about that as we go along. So there's a lot of huge benefits to going to therapy. Changing negative thought patterns. What I mean by that is just human nature. We tend to go to the negative a lot. We constantly think about the what ifs. We think about, oh, well, of course I can't have that because, I'm broken or I'm dumb or things like that. So changing those negative thought patterns to, what if I am successful? What if I am smart? What if I deserve really good things in life? So therapists really try to remind you of like, hey, you don't have to think so negatively. You can change those thought patterns. Processing trauma as well. Like I said, I'm an EMDR trained therapist. So using that is very good for trauma, but even just talk therapy in general can really be beneficial to talk about your trauma. Working on generational issues. When I say that, I mean, a lot of times we have family issues that kind of go from generation to generation. If you look at your family tree, you can kind of tend to see some patterns. Maybe it's drug abuse, maybe it's, physical or sexual abuse or things like that, that do tend to run in the family, or even just any type of anxiety disorder or depressive disorder. Those things do run in the family. So by you kind of going to therapy, you really are breaking those generational patterns, and that's really huge. And it also helps you realize your strengths. Like, how often do we go through life and kind of don't think about the things that we're good at? It kind of helps to remind ourselves, like, hey, I'm really good at this, or I'm very confident in this area. And therapists really do try to help you remind yourself of that. Again, being more understanding with yourself, realizing like, maybe this is why I behave the way that I do. And having individual goals. Therapists are there to help you kind of figure out, well, I would really like this in life, and how do I get there? So some things you can definitely do on your own. Again, like I said, inner child work, you can really kind of look back at who you were as a child and figure out like, gosh, what would my past self really need to hear? Also, journaling is really good to process feelings. You can journal about just how you're feeling. You can do actual journal prompts. I give my clients journal prompts sometimes, and they find it really helpful. You can work on a lot of grounding techniques. What I mean by that is just ways to help regulate your emotions, to help calm yourself down. Meditation as well is a type of grounding technique. Again, it gives you that self-compassion to just, be kinder to yourself. Next time you make a mistake, maybe you'll catch yourself and be like, hey, like, okay, I made a mistake, that's okay, and kind of move on from it. And opposite action. What I mean by that is, especially with depression, you tend to go through depressive cycles. So like if you're depressed, you feel like you can't get out of bed, right? But you can't get out of bed because you're depressed. So it's this vicious cycle. So one thing I try to teach my clients is opposite action. So, okay, you feel like you can't get out of bed. Maybe try just like sitting up and drinking some water, right? Like trying to change that cycle in whatever way possible. Just doing one small different change can make a huge difference. All right, well, that was my presentation. Thank you so much. And yeah, I just want to remind you all again that you're definitely not alone. Thank you.
Thanks, Brianna. Well, now Angela will be touching on maintaining wellness and acceptance. Some of you may not know that Angela is very special to us, being that she was one of our very first speakers at our first webinar, Back to School. You can find that recording on our YouTube channel as well. And so, yeah, we're very excited to have you again, and take it away, Angela.
Thank you so much, Avery. So thank you again, everyone, for being here. Today, I am really going to focus on my own personal journey with mental health and where I'm at today, as opposed to a clinical or professional perspective. So hopefully this is helpful and you're able to enjoy. So a little bit about me. I'm not going to go through all of this. But I am from the Seattle, Washington area, born and raised. And I currently work with adults with intellectual and developmental disabilities for my job. So even though I am very passionate about people with physical disabilities and that sort of disability advocacy, people with all types of disabilities is really a passion of mine. And something I really enjoy. And currently, right now, I am in a clinical psych program at Seattle Pacific University, and my ultimate goal is to specialize in rehabilitation psychology, which is the branch of psychology that works with people with disabilities. Okay, so I wanted to start off the presentation by giving you a little bit of my story. I think it's really helpful to share this sort of information to kind of give you a perspective of what my own disability identity has looked like and how that has influenced my mental health over the years. So I'm sure a lot of you have had very similar stories, but I was born in 1983. And really at the time when I was born, the only noticeable symptom about me was that I was very small and a lot of very weak neck muscles and very low muscle tone. And then as I grew older in my toddler years, my parents noticed that I had a very abnormal gait, and I completely skipped crawling. I wasn't able to do that at all. So they took me to a neurologist, and I had a bunch of genetic testing done. But actually all of the genetic tests results came back negative. So they're like, okay, we're pretty sure that this child has a form of muscular dystrophy, but they really had no idea what type. So, you know, I saw doctors throughout the years just as sort of check-ins, and really didn't have a diagnosis. So fast forward to 2006, you know, I was chugging along, living life, but I got a really bad case of pneumonia. And this resulted in respiratory failure. You know, I was in the ICU for a week, hospital for a month. And up until this point, no one had any idea that I had respiratory weakness. Even though looking back, I actually had that, you know, up until that 1995 range. So somehow between 1995 and 2006, I should have been on BiPAP, but I was not up until this pneumonia episode. So I started on BiPAP, and then in 2007, I had spinal fusion surgery for my pretty severe scoliosis. And then finally, in 2011, when I was 17, I got my SEPN1 diagnosis. SEPN1, also known as Selenon, congenital muscular dystrophy. And here's just a couple of pictures. I wanted to include this picture of me. This is actually fairly recently, like a couple years ago. I had surgery. I wanted to include like happy pictures, and then also just, very real and raw pictures to show the realities of living with a disease like CMD. Okay, so based on all of this, how did I pursue mental health as a career? And honestly, a lot of my reasonings behind this is very similar to what BRIANA was describing in her presentation. It's, largely based on my own experiences growing up with a disability, which I will touch on that in a little bit. I mentioned my pneumonia and respiratory failure when I was in 6th grade, 2006. And that was my experiences as a patient at Seattle Children's Hospital. I had been in the outpatient clinics for many, many years for check-ins, but really those inpatient stays had a huge impact on me and my family. And, as difficult as those moments were, I had this overwhelming feeling that when I grew older, I had to work there myself, and that I had to give back to a community that had done so much for me and that really saved my life. And I felt a strong call to help people similar to me. So in my little 12-year-old mind, to me, that meant, oh, well, I must be a medical doctor. Like, that's the way that I have to help other people like me. And so that was my plan for many, many years. I was pre-med through like half of college. And I didn't really consider mental health at that time, but that definitely changed, which we will get to. Okay, so I wanted to do a little bit of reflection on self-acceptance. So I said that I would touch on how I got from the idea from, being a medical doctor to a psychologist, and I will get there. But some 3 themes that were really prevalent and have been prevalent in my life are this idea of disability identity, finding meaning in suffering, and then releasing control. And so, funny enough, I really didn't identify as being someone with a disability until high school. I didn't start using my mobility scooter until college. And so even though I had a very abnormal gait, and I was pretty small and had a super low muscle tone, I physically didn't see myself as having a physical disability. And throughout the years growing up, I didn't want to be seen as different. And so it was really never talked about. The word disabled was never used until high school, when a counselor at my high school, she suggested I apply for this program at the University of Washington called the Do It program. And I'm sure there's very similar programs in other states in the country. But basically, it's a high school to college transition program for students with disabilities. And they teach you a lot of self-advocacy skills, what it looks like to look for accommodations, answer questions about the unknowns of what being, on your own in college will look like. And then you actually stay in the dorms on the college campus to get idea of what you might need and what that looks like for you. And so this was incredibly pivotal in my life of how I viewed myself. And I kind of started to shift my views, and I was like, oh, okay, yeah, I actually identify with that. That's me. And I met other students with different types of disabilities. And I had never done that before. And so for me, I was able to see like, wow, I'm not alone. Like there's other people like me. And so very grateful for that experience. Another theme that was very pivotal and has been pivotal for me is finding meaning in suffering. And so during college, in one of my philosophy classes, we read Viktor Frankl's Man's Search for Meaning. And for me, reading this book was so eye-opening. Basically, Frankl in the book talks about how through moments of suffering, you can find meaning and that your life has purpose. And for me, like I'm a pretty religious person. And so, up at that point, I had a lot of questions of like, why me? Like, why do I have to deal with this? Why do I have to, have a disability and all the adversity that comes with that? And so reading this book really tied into my questions that I had and that were, difficult for me to answer. And so I realized like, wow, like I have this purpose, in my life, and that I can find meaning in all the adversity that I've been through. And then I had this dream of wanting to help people similar to me based on my experiences at Seattle Children's. And so at that moment, I realized, okay, wait a minute, like I don't have to be a medical doctor to be able to do that. I have all these unique gifts of listening and being empathetic to others. And I can serve them in a different capacity and still help other people find meaning in their life despite their adversity. And so that's where the idea of, wow, like I can be like a therapist and a psychologist and really have an impact on others. And then also I've been pretty involved with the MDA for a while in my young adult life. And then my involvement with CMD was also really pivotal in, finding purpose and meaning in my life and being able to connect with others and also my disability identity as well. And then the third theme that I wanted to touch on was this idea of releasing control. So currently, right now, I'm definitely in a spot of trying to release my control that I have over my disability and my SEP1. And so despite doing a lot of the like right things, going to physical therapy or, trying to use my muscles as much as I can, but not too much, I'm still finding in the past couple of years that I've had some muscle loss, which has just been outside of my control and honestly a really hard thing to grapple with. And so I wanted to touch on that because I think it's a real thing that many of us can relate to, like despite doing so many things for our health, there's that aspect that no matter what we do, like we're still going to have difficulties and we still might have weakness and muscle loss. Okay, so I wanted to touch a little bit on what managing my own care and my own wellness has looked like for me. So, I think it's pretty common to have doctor appointment burnout or medical appointment burnout and just care burnout, like all the things that we have to do to keep ourselves well and manage different things. I've had this perspective of not wanting to let my SEP1 control me. Like it's very much a part of my life and my identity, but I don't want it to be everything. So keeping that perspective in mind, I try to, I do what I can to take care of myself and make sure I'm well. But I really want to make sure there's other aspects in my life that I'm giving my attention to. And for me, that perspective helps with that burnout that I think can be so common. Something else I wanted to touch on is the pandemic that we are currently in. Obviously, COVID has been very difficult for all of us in terms of isolation, depressive type symptoms, anxiety. And, I'm sure a lot of you, like me, have been concerned of what might happen, in terms of respiratory health. My respiratory muscles are quite weak. And so I am high risk in that regard. So, COVID has definitely caused a lot of anxiety for me and my family. And I think it's the idea of, ICUs and breathing difficulties has brought up a lot of trauma from my past, especially the moment where I had lung failure. And so that's been difficult to deal with. And honestly, more so for my parents, I think, than me, just bringing up a lot of memories of that. Something else that has been really important for me and something I can definitely improve upon is not playing the comparison game. I think I tend to compare myself to my peers, whether they have a disability or not. And I know that thought process is very unhealthy and something that I try to avoid. And I think can be really helpful for other people as a way to manage their own mental health. Another thing that I found has been really helpful, especially in the pandemic, is embracing the small moments of joy. Like my activities might be pretty limited, and life might look a little crazy right now, but those small moments of joy that I am able to experience have been really helpful for my overall well-being. And then, so I wanted to list a couple of things that I do to find those moments of joy and ways that I can help myself for my overall well-being and mental health care. So something that I like to do when I'm super stressed and anxious is make a cup of tea and just try to sit there and be mindful of that tea and embrace that small moment of joy. Calling my best friend is always something that's really helpful. You can see us here wearing our masks in Seattle by the water here, listening to Taylor Swift or whatever kind of music makes you happy. For me, praying is really important. Eating well and sleeping well are also very important things for managing overall wellness and mental health, and something that I try really hard to stick to, which is not always easy to do as a busy grad student. And then the last point I wanted to make was therapy. Obviously, like BRIANA was mentioning, there's so many benefits of therapy. And I'm currently not in therapy right now, but I have been in the past a few years ago, and highly recommend it. And it can offer so many different benefits, like BRIANA was mentioning. Okay, so that is it. Hopefully this is all helpful to you to get a little glimpse into what my own mental health journey has looked like, and that the role it's played in my life. If you have any questions, please feel free to email me. You can find me on Instagram too and message me there. And I look forward to hearing from all of you soon. Thanks so much.
Thank you so much, Angela, again. So thank you everyone for joining us. Thank you to our very insightful speakers. We're so thankful to have you guys. We hope you found value in these new mental health practices you're starting to learn about in this series. Care CMD is a great resource to connect with others traveling the same journey as you, as I mentioned before. To find links, you can visit our website at carecmd.org. And you'll find support groups under the community menu tab. Those are very helpful. And then also save the date for our next webinar on February 12th, actually next Saturday. So that will be really fun and informative. We get to learn about activities or hobbies that affected individuals can partake in to maintain a healthy and fulfilling lifestyle. And of course, as always, if you have any questions, feel free to reach out to us at outreach@carecmd.org. We're more than happy to answer any questions, whether that be about the webinar or other CareCMD programming. And then don't forget to save the date for SciFam this summer. We're very excited to be back in person and to be heading down to Nashville June 30th to July 3rd. So for more information and to subscribe for email updates, you can go to scifam.info. And then we would love to keep the conversation going. Share with us what you learned today by tagging us at CareCMD on socials, and you can use the hashtag CMD Mental Health. Thanks everyone again for joining us. We hope to see you for part 2 next Saturday, and have a great rest of your weekend.